I'm joined right now by Dr. Bernd Krause, who is the president of the German Society of Nuclear Medicine. Thank you so much for being here. I know at this meeting in 2017, Germany is really the highlight country. So many innovations there in terms of nuclear medicine. Can you discuss some of those?
Yeah, the innovations in nuclear medicine are with radiopharmacy and with instrumentation technology, especially with positron emission tomography combined with MRI. And there are major advances have been made over the last years, and main driver of innovations came from Germany.
And it's not just about diagnosis, this is about treatments as well.
So it's for diagnosis and treatment, and especially in radiopharmacy there have been major developments for diagnosis, like for neurodegenerative diseases like Alzheimer's disease, but also in oncology. And in oncology, the theranostic concept is that first of all we do diagnosis with the radiopharmaceuticals, and in the second step then really do therapies based on these developments.
Are there differences in the rules, for example, in Germany versus the US that are allowing for further advancement?
Yes, for the development there are major advantages in Germany because due to the legislation we are allowed to do first-in-man study quite early, so the translation from research pharmaceuticals into clinical practice, that's much easier in Germany compared to the United States.
And one of the patient populations who has been benefiting most are those with metastatic prostate cancer. Can you talk to me about some of the options for people now?
This relates to prostate cancer and especially the advanced stage. So we have with PSMA a radiopharmaceutical that we can use for diagnosis with PET-CT or PET-MRI, and also for therapy of advanced stage patients. And the advantage is that by beta irradiation we are able to really target the tumor lesions distributed in the body and to do a very effective treatment with a rather low side effect rate.
Being here at this meeting, what are you most excited about talking to some of your US colleagues about?
So a lot of discussions are on the radiopharmaceuticals, on the therapy, and one important step further will be multi-center studies. So we are discussing concepts of multi-center studies. On the other hand, there is much of a focus on standardization of nuclear medicine products and methodologies across the world. So we try to standardize our methods and the technologies.
How challenging is it to standardize and do these multi-center studies when there are, as you mentioned, different rules between US regulators and Germany?
Exactly, that's the point. So we try to get the best out of the different systems, but still it's an effort to really align methodologies across countries, taking into account the instrumentation but also the legislation. It's really a challenge, but we're pretty confident that this will work out.
And by working on it, it can only advance science, and that means advancing the lifespan for people who have really life-threatening diseases.
Yeah, exactly. That's the most important point, that really we get our products of nuclear medicine into patient care.
All right, thank you so much.
Thank you.